Salutations and welcome back to my channel. My name is Kidology and I make videos about everything and anything to do with modern society. Now, just before getting into this video, I do need to add a disclaimer. I'm going to be talking in a lot of euphemisms just because, well, we're on YouTube, so for obvious reasons, but also because regrettably a very well-known thing within this community that I'll be speaking about is that a lot of urologists and a lot of these clinics have a overwhelming tendency to sue anybody who mentions them by name or who leaves a negative review, as I guess this video in a sense is. This video is purely for educational purposes. It is purely an analysis of information that is out there. This video most definitely is not just my opinion and my perspective. There is evidence to back up everything that I'm saying, and I will leave all that evidence in a Google Doc for you to peruse at your own leisure. This video is also fair use and is protected under copyright law. And now, with all of that being said, let's get into it.
One time I walked in on him naked and his thing is so small.
Whoa. For centuries, men have been fascinated, if not obsessed, with the prospect of elongating and strengthening their candelabra. It has a lot to do with masculinity, but I would definitely say that at least in the past 20, 30 years, it has more to do with the placing of unrealistic beauty standards, no longer exclusively on women, but more and more so on men. Men, that is your everyday man, is being made to feel incredibly insecure about his body in ways that, in history at least, I have not seen before.
The only alternative for these bottom tier guys, which again is the same for all three tiers of women, is pathetically beta buxing to try grab hold of whatever they can get. For these guys, it's either that, moving abroad, having a miracle looks transformation, or living in a basement forever playing video games all day.
And at least according to the narrative online and in pop media, this is seemingly in pursuit of a man increasing his sexual market value in a dating market that is increasingly hostile to him and where looks are deemed to be everything. Men are also living a lot longer, and the pressure, especially by male celebrities and at least how they are represented, for men to age like fine wine is overwhelming. And this no doubt plays into this increasingly image-obsessed rise in cosmetic procedures and surgeries among men in the modern world. The cosmetic procedures that men in the US request the most are pretty similar to that of women, namely rhinoplasties and liposuction. However, there are some interesting differences. Eyelid rejuvenation and male breast reduction are very popular with men, but there is noticeably one that is experiencing a surprising boom. As I said, for centuries, men have been obsessed with the prospect of strengthening and elongating their candelabra. But this obsession has recently hit not just new, but increasingly catastrophic heights. And this boom is big, but maybe not so much as the boom in our need, in my humble opinion, to communicate better with our intimate partners and loved ones. Much of what I'm going to talk about has a lot to do with our culture's inability and shame around speaking honestly and openly with our significant others about intimacy and that is why I am so delighted to be working with Beducated again. Now, you know how much I love and vouch by Beducated, not just for its educational value, but just as much for its personal value. As the world's largest online resource for everything intimacy and relationships, Beducated is a completely safe, non-judgmental, and overwhelmingly diverse platform that brings together toe-curling pleasure and expert-backed sex ed. I personally appreciate the versatility and the breadth of Beducated. There are over 100 courses, both long form and short form, for singles and couples, for those of us who are more vanilla, to those of us who are a little kinky, to far kinkier. Beducated's approach to sex ed really appreciates how sex and learning about yourself, about your body, about your preferences and those of others is really a lifelong endeavor. And it's really not just for people who are young and single and enjoying life. It is really for everyone. It is a fantastic resource for those in relationships. And you know, Beducated's library of courses for people in relationships or individuals who are partnered has really made me reflect on my own relationships with people, especially in showing me how both of us could have really been better partners to each other. A lot of couples really struggle with a mismatch in sex drives, and I can most definitely relate to the very harmful cycle that often perpetuates. One partner feels like they're not desirable to the other partner, and a lot of resentment, a lot of hurt, and a lack of real vulnerable respectful, honest communication can ensue. And it's really sad to see. I have most definitely been in that situation. Out of curiosity and also just wanting to be a better partner, I took a course on sex drive mismatch by sex educator Sabrina Baldini. The course was so insightful on understanding different relationship types and also just understanding the differences between, I think, very important words such as sex and intimacy, on differentiation styles and attachment styles of relationships. I just found the course incredibly cathartic and very eye-opening on how common an issue this is, not just for people who are in relationships, but also for people who are single, who are trying to understand relationships and who want to be in relationships and have to get through a lot of the issues that come with being in a relationship, inevitably. And what I really liked and appreciated a lot about Baldini's approach is that she doesn't just tell you that communication is important when it comes to relationships, when it comes to intimacy, when it comes to sex, but actually gives you the tools and gives you the how to communicate, which I think is so missing from a lot of sex ed, where it's just about, you know, you need to communicate and you need to talk. How? And she really answers that how with not just useful but practical tips and advice. So if you want to get started on your sex ed journey, remember it is never too late nor too soon, then use my code Kidology to get a whooping and incredible 40% off your Beducated yearly pass. And what I especially appreciate is that this deal is completely risk-free. You will get a 24-hour free trial and a 14-day money-back guarantee. All you have to do is use my special link down below with my code Kidology to get your 40% off your Beducated yearly pass. Thank you so much to Beducated for sponsoring this video and for upholding the importance of pleasure-based sex ed for all. And now let's get back to it. In 2000, 3 practitioners of Yin Dao Gong, which literally means genitals hanging kung fu, used their candelabras to pull a flatbed delivery truck in a Taipei parking lot with ambitions of one day pulling a 180-ton Boeing 747. According to some masters, Yin Dao Gong, also known as Qiu Qiu Shen Gong, dates all the way back to the Shaolin Monastery and Chan Buddhism. That is, all the way back to the 6th century. According to one Taoist monk, Yin Dao Gong is the 5th stage in a 9-stage path to enlightenment. 5 of the stages involve mastering the art of contorting and strengthening the phallus and package. An underlying belief taught by some masters of Qiu Qiu Shen Gong is that strengthening the member with hanging iron blocks will improve libido and increase hormone production. It is perceived as the ultimate symbol of masculinity, and I would say that this is definitely the starting point for many men in the candelabra enlargement community and world beyond Taiwan. This can most definitely be considered stage 1 in what from this point on I will be referring to as the p-enlargement community. Now, hanging weights from your candelabra has been scientifically proved to in no way increase the length of your member. It has, however, been proved to most definitely fracture it and to potentially permanently damage it. And this is something that several Taiwanese practitioners of Qiu Qiu Shen Gong can most definitely attest to. The art, as it were, of hanging weights is most definitely not recommended by medical professionals with a conscience. So let's move on to talking about medical professionals who allegedly do not have a conscience. Introducing LG Hanger Limited Liability Company.
Self-confidence. Some men have it, others want it. LG Hanger can help you get it. The LG Hanger system is basically a traction device that uses a unique, custom-made vacuum chamber. It was designed and has been tested to hang up to 25 pounds. Most other devices sold today only achieve approximately 5 pounds. Since major gains start to occur at about 8 to 10 pounds, it only makes sense to invest in a system that can get you where you want to go. The system is easy to use. Simply attach the system chamber using the silicone sleeve, secure the sleeve with the Velcro strap, apply vacuum, and attach the weight. Find out how you too can get more self-confidence now.
You can get your LG hanger package for $474 and get personal consultations with a Dr. Richard Howard II. Dr. Howard is the founder of My P Doctor. You can train your candelabra like a bodybuilder for a non-surgical way to increase length, girth, and stamina. Dr. Howard claims that he can add 50% to your length and girth, but he importantly adds a disclaimer. Please realize that this is a very approximate percentage because there is great variability from individual to individual, ranging from genetics, enthusiasm, studiousness, patience, consistency, and time spent on the process. Which basically means that if our products and services don't work for you, that is because you, mister, haven't invested enough of your money into our products and services. Dr. Howard is endorsed by Surgery Life Enhancement. It's important to note that a lot of these clinics and a lot of these urological entrepreneurs, as I like to call them, use the term enhancement to make these procedures and these interventions sound a lot less invasive and risky. Many of these enhancement urologists are all about subtly feeding into their patients' insecurities. This clinic, for instance, acknowledges that most of its patients were well in the range of average to above average in their size. Now, this is very, very important information. Now, the vast majority of urologists in the modern world are categorically opposed to such procedures and enhancements due to the various recorded risks, as well as the lack of any viable evidence for their efficacy. The American Urological Association states that the only legitimate reason for surgery is a condition called micro-P, which is basically when a stretched P length is less than 7.5 centimeters. Not only is micro-P considered a medical condition, it is also incredibly rare. However, Surgery Life Enhancement knows better than the American Urological Association. Some urologists and doctors are only pro P-enlargement surgery when the man's candelabra is well below average and considered a micro-P. At Surgery Life Enhancement, we provide P-enlargement for all men, regardless of your P size. And that they most definitely do. You see, it's not merely a single simple procedure over the course of one lunch break, as one TikTok doctor claims in her video trying to sell her non-surgical penoplasties. What this doctor is referring to is the popularizing injecting of either filler or fat or even both into the shaft or the head of the candelabra in order to create volume. If you want to enjoy the full effects of fillers, you inevitably have to keep booking appointments. P-fillers are all the rage when it comes to male cosmetic procedures, especially non-surgical ones in the P-enlargement community. And I would say that just based on my research, there is a very straightforward pipeline from non-surgical fillers to eventually men going under the knife. The reason for this straightforward pipeline, in my opinion, is because most clinics use natural hyaluronic acid filler. Unfortunately, natural filler is eventually going to be absorbed by the body. The longest filler, and therefore the most expensive filler, lasts for up to 2 years, and top-ups are recommended. The good thing about natural fillers, however, is that they create a natural-looking enhancement. They mimic our own body's natural hyaluronic acid, which we have in our joints, in our skin, and in our eyes. The bad thing, however, as I said, is that the body inevitably absorbs it. And so to counter this downside, some clinics will opt for or will allow their patients to opt for synthetic fillers that are either semi or fully permanent and non-reversible. The most popular of these fillers is called Bellafill, and one urologist that I found likes to incorporate this filler into what he calls his man-up procedure. And just a brief summary of what the man-up procedure is: 10 syringes are used for the first treatment. This is not the only treatment, you have to keep going. Each syringe contains a mixture of a man's plasma-rich protein and the filler. The protein and filler are then combined and thinned down before being injected into a man's candelabra. Did I mention that it's injected 10 times? And that is only in the first procedure. And what is just as horrifying is the average cost of these candelabra filler treatments, which, mind you, are done in under an hour. On average, the hour-long appointment will cost a man just under $2,000, and that does not include the cost of the filler. The fillers, depending on the brand and type, will cost a man from $650 per 10 milliliters to $3,200 $230 per 20 milliliters. So a man should be expected to spend anywhere from $2,650 to $5,230 for an hour-long appointment to have 10 injections injected into his member. And remember, this is all non-surgical P-enlargement treatment. This is considered the cheapest and the least invasive option for men. And so with all of this being said, it is absolutely no wonder to me why the P-enlargement market is booming and is only projected to boom. Now, this boom is mainly speculated to be the result of men in modern societies experiencing higher levels of ED, especially since the panini era. Apologies, I have to use a euphemism for this because YouTube doesn't like people talking about that particular era that we all went through, where we were locked down, where we all wore masks, you know what I mean? In fact, studies conducted since 2020 show that men who contracted the virus may be 6 times more likely to develop short or long-term ED. Another speculated factor can be found in the most recent clinical reports and studies, which show an unprecedented trend. There has been a sharp rise in men under 40 experiencing ED, delayed explosions, decreased satisfaction, and diminished libido during partnered intercourse. And this sharp rise correlates with the advent of so-called explicit tube sites on the internet. A 2014 study of newly diagnosed ED in active duty servicemen aged 21 to 40 showed that rates of ED had more than doubled from 2004 to 2013. Significantly, the military cross-sectional data revealed that the increased ED problems were associated with anxiety and male genital self-image. And I think just as significantly, a mere 1.64% of male military personnel sought out medication to help manage their ED. This military personnel sample is a great microcosm of a wider societal issue. On the one hand, young men are increasingly having problems with male self-image. This is largely attributed to the growing consumption of unfettered, explicit adult content, as well as greater anxieties around partnered intercourse. On the other hand, the social stigma associated with ED has really compounded the issue. Men aren't prepared nor are encouraged to seek out medication and therapies because of shame. The only solution that appears to be on offer, that is filling the gap created by these two compounding issues, is the P-enlargement market. All you have to do is make your candelabra artificially and invasively bigger, and all your problems will be no more. But is that true? Now, in my opinion, not all innovators deserve renown or accolades, and I would most definitely put Dr. James Elst into this category. This man is allegedly responsible for so much, not just physical prostate damage and trauma, but the most horrendous, almost unbelievable psychological trauma and angst that I have perhaps ever seen and read about. As a result, I really do have to disclaim this section. I also need to note that I will not be using the actual name of the device that Dr. Elst invented, because he has a tendency of suing anybody who even breathes the actual name of his device because of everything that I am about to go through. So I will instead be using my own little euphemism called the P-Sheath. I have left sources and information and investigative journalistic articles below, all into what Dr. Elst has been doing since the 1980s. It is fascinating, if not horrifying stuff, especially when it comes to the P-enlargement community and what he has been doing in that world. Now, Dr. Elst is the main character when it comes to individuals in the P-enlargement community transitioning from non-surgical procedures to surgical procedures. Now, before Dr. Elst, the most common surgical procedure for P-enlargement was basically a procedure which is the severing of the suspensory ligament which connects the shaft to the pubic bone. And ultimately, by snipping this ligament, it creates the illusion that a man's resting candelabra is longer. Now, a lot of urologists actually consider this to be a form of mutilation because you are severing a ligament that is actually very essential and is therefore a reason. And I would most definitely agree that this does seem like a form of genital mutilation.
There's a ligament that holds the up, and when you cut that ligament, it drops down, and it can actually increase in length maybe a quarter of an inch or a half an inch. Not enough to even be significant, but there's risks with that. Then there's techniques where they can inject fat into along the to try to make it look bigger. But even if you look at interviews with hundreds of men who've had these enlargement operations, almost all of them have disasters. They're unhappy. They don't like how it turned out. And time and again, the interviews almost always ended with the man saying, I wish I never did this, avoid it at all costs. It's not what you think. Complications are horrible. Imagine getting a horrible infection down there. The scarring, the misery, the chronic pain, curvature that can't be corrected. Most men that opt for enlargement surgery using current technologies are very, very unhappy, and it's really not a wise thing to do.
And the sad thing for men is that this so-called P-length surgery can only increase the length of a man's resting candelabra by no more than 2 centimeters. Okay, so here's my ruler. So it will only increase it by that much at the most. I'm sorry, in researching this video and also just in now recording this video, it's so heartbreaking. It's like going under that much pain and going for surgery and under the knife to sever a ligament just for that. Body image issues are real, and my goodness, that society does this to people is just heartbreaking. Honestly, oh jeez, I need a soda. And it's really important to note that this 2 centimeter increase is only for the flaccid candelabra. The surgery sadly does not and will not increase the volume or the length of a man's member when it is happy. And importantly, because a lot of the surgery has to do with self-image and a lot to do with, as I said at the beginning of this video, increasing a man's sexual market value, the surgery has a clear and obvious downside for most men. What is the point in getting the surgery when your happy candelabra is going to look exactly the same as it did pre-op? Enter American-Iranian neurologist Dr. James Ellis with his solution in the form of his invention, the P-Sheath. The P-Sheath was invented by Dr. Ellis in the early 2000s, and it is a translucent sheath that comes in 3 sizes: large, extra large, and extra, extra large. A few years ago, he was featured in GQ, which really increased his fame and notoriety, with the heading, "Huge News, the Bionic D is here." Now, all the way back in the 1980s, Dr. Ellis was inserting what was then the most widespread type of implant into the spongy tissue of impotent men's members. These implants, invented all the way back in the 1970s and used all the way through the 1980s and onwards, believe it or not, were inflatable prostheses. Now let me just explain how this works because it is pretty fascinating. Basically, a pump is placed inside a man's sack, and a man will then manually, with his hands, squeeze or pump his sack in order to then trigger a reservoir that is placed in the base of his stomach. And this reservoir is connected to and causes cylinders that are inserted inside his shaft to inflate and to stand upright. Basically, this implant means that an individual can manually and quite literally at any time create a happy member. As I said, these initial implants were invented in the 1970s. They were invented in Texas, and they've proved pretty successful in helping a lot of impotent, especially older men, when it comes to their intimate lives and intercourse. And I think very importantly and interestingly, this procedure is not considered cosmetic in as much as it is considered a surgery to help men who experience severe ED or are impotent due to a disability or an accident. The late publisher of Hustler magazine, Larry Flynt, who became paralyzed from the waist down after being shot in the late 70s, had one of these inflatable implants. It was very interesting reading what the late Harry Flynt had to say about his implant, especially because I just can note that no men are open about this, obviously because of just shame, because of the stigma surrounding impotency. And so it's very interesting reading Larry Larry's story, even though he is not the most conventional individual, and I really personally just do not have much high regard for individuals like him. But nonetheless, he is probably the only infamous story and infamous individual who has been open about having one, and I do think that is noteworthy and to an extent commendable in being open about it, even though I don't really know if his reasons for being open about it were entirely for the purpose of making men feel better about themselves and breaking the stigma or the shame around such procedures. No, I really don't think that the late Larry Flynt was all about breaking stigma around such things for other men. However, what would and does regrettably happen with these implants is that over time, the body eventually absorbs both the cylinders and the pumps. And this actually results in men's candelabras shrinking, or sort of in a way kind of shriveling up a bit after a few years of having the implant. God, men can't catch a break in this video. I'm so sorry. So what happened in around the 80s and 90s is that Dr. Ellis went about trying to rectify this problem by firstly replacing the cylindrical implants and pumps with silicone. Silicone is very important and noteworthy in the cosmetic surgery world. Silicone is used and preferred by surgeons because firstly, it is FDA approved. And this basically means that many medical device manufacturers can get around loopholes if they can show that their product is basically exactly like what is already on the market. Because if stuff that is already made from silicone is FDA approved, then my new gadget that is made from silicone will inevitably be approved because it would just be a double standard on the FDA's part. And secondly, and I would say most importantly for especially surgeons and liability claims, is that silicone is not absorbed by the body, which means that it can be removed. And therefore the only downside of silicone is that you have to get it replaced or eventually removed. So for instance, when women get breast implants, they will have to eventually get those implants removed or will have to continually get them removed and replaced throughout their lifetime. Basically, in the world of cosmetic surgery, silicone is a lifetime financial commitment. And in getting his invention approved, Dr. Ellis allegedly literally referred to his invention as a silicone block comparable to calf and butt implants. But anyway, what Dr. Ellis invented was the P-Sheath, and it has now been trademarked and revigorated, I guess, to be the plant. And interestingly, as of at least 2019, Joe Rogan was endorsing the P-Sheath. I doubt, based on what has recently transpired, that Joe Rogan will be endorsing the product for much longer, at least on his YouTube channel. But if Joe Rogan is promoting and shouting out this product on his podcast, then you can imagine how popular this device has become. How many men have looked into it? How many men have perhaps gone to this doctor, sought out his services because of what they have seen on the likes of these platforms? Now, the P-Sheath procedure is astonishingly expensive. A single procedure will cost a man from between $15,000 to $16,000, and that, of course, is not going to be covered by insurance. The sheath is inserted under the skin and is supposedly meant to move around somewhat freely, which makes the enlargement look more natural. As of 2023, Dr. Ellis is credited with training at least 70 urologists in this procedure. However, based on patient testimonies, one thing that Dr. Ellis and his trained urologists are known to do is use Covidian polyester mesh, colloquially known as hernia mesh, in order to insert and keep these implants in place. Mind you, there have been global reports of especially men being left in chronic pain after having hernia mesh surgeries to treat groin hernias. There's actually men in Northern Ireland who formed a support group to campaign for the suspension of the use of hernia mesh in surgeries until more is known about the causes of this chronic pain. And this chronic pain is very important and noteworthy when it comes to the mounting complaints leveled by men who have had the P-Sheath procedure. Since the mid-1990s, at least 23 malpractice lawsuits have been filed against Dr. Ellis in Los Angeles alone. And this isn't necessarily unusual, especially especially in the world of cosmetic surgery. But what is unusual and is noteworthy is how similar all these complaints are. Award-winning investigative journalist Ava Kaufman interviewed dozens of Dr. Ellis' former patients. For dozens of P-Sheath patients who spoke to me, the shock of the new was the prelude to graver troubles. Some, like Mike, lost sensation. Others said they experienced stabbing pains in the shower or during intercourse. Seroma, or excess fluid, was not uncommon. When a defense and intelligence contractor's girlfriend, a registered nurse, aspirated his seroma with a sterile needle, a cup of amber fluid oozed out. The one time they tried to have intercourse, she told me, the corners of his implant felt like someone sticking a butter knife inside me. Some implants got infected or detached. Others buckled at the corners. Occasionally, these protrusions broke through the skin, forming holes that would fester. The hole of a health spa vice president who got the procedure was so tiny that he occasionally mistook its fermented odor for an STD. An engineer played me a video of the snorting crunch his candelabra made when air moved through a hole. He had 2 holes, and the skin between them eventually eroded so that a corner of the implant emerged, pearlescent. Lord have mercy. Now, as a result of these botched jobs done by what I like to call urological entrepreneurs, a subculture of reconstructive urologists has emerged. And it is basically the job of these reconstructive urologists to fix these botched jobs. One reconstructive urologist that I found, called William Brandt, fixes up to 10 P-Sheath procedures or botched jobs per month. Another urologist who is London-based, called Gordon Murr, who has actually been increasingly vocal and publicly vocal about the harms and the risks of getting these kinds of procedures, has been traveling across the world in the past few years just to remove P-Sheaths. And sadly, when a man who has gotten a botched P-Sheath job gets it removed, this is only the beginning of his troubles. After getting the sheath removed, a candelabra is never the same. When a foreign object is placed in the body reacts by forming an envelope of tissue around it. In the candelabra, a retractable organ, this new tissue can distort shape and mobility, causing the member to shorten and curve. The disfigurement can be exacerbated if the P-sheath is removed, since the member can contract to seal up the vacuum of space, a phenomenon that patients have called the mini-D or D-lit phase. A lot of men, after getting their botched jobs fixed, are advised by reconstructive urologists to use a device called the Restore X, which costs a minimum of $525. This device has a clamp and extension rods, and with that information alone, I am quite sure you can imagine how painful this so-called penile rehab regimen is. And on top of this penile rehab regimen, most men are prescribed antidepressants for obvious reasons. Their members are never going to feel, function, or work the same again, and many have reported to not be able to feel any sensation down there since getting the procedure. Now, even though this has been going on for years, Dr. Ellis was only reprimanded by the Medical Board of California for the first time in 2019. He was reprimanded for repeated negligent acts and departure from the standard of care, as well as failure to maintain adequate and accurate medical records. The cases underlying this reprimand involved a 37-year-old patient and a 54-year-old patient of Dr. Ellis. Now, what is most noteworthy about these cases, and what is, in my opinion, most reprehensible, is that Dr. Ellis diagnosed both of these men with penile dysmorphia. Penile dysmorphia is not a recognized clinical term or diagnosis. This term has simply been coined by the likes of Dr. Ellis to justify operating on perfectly normal-sized men who are then far more willing to go under the knife when they are convinced that they have a mental illness like BDD. And usually when somebody is diagnosed with BDD, they are initially and primarily prescribed therapies, and in extreme cases, SSRIs SRIs. However, Dr. Ellis allegedly decided not to only diagnose his 37-year-old patient, but decided on the very same day of diagnosing him to operate on him. And I think something that is also very interesting here is how many men's testimonies I read and referenced where these men, who were all patients of Dr. Ellis or of the other urologists who he trained, had self-diagnosed themselves with what is called Peyronie's disease, which is literally when you have a curve in your member. 1 in 10 men in the United States have Peyronie's disease, and some men experience pain during intercourse and of course have to deal with, especially nowadays, the psychological effects of perceiving this as a defect or something that is wrong with you. Now, although Peyronie's disease was first diagnosed in the 16th century, shame is really at the root of a lot of men not seeking out treatment and also having to deal with on their own the psychological effects that come with self-image issues in relation to having a curve in your member. Basically, I think a lot of shame and a lot of embarrassment and a lot of feelings of inadequacy underlie Peyronie's disease and why it isn't spoken about a lot. And again, in my opinion, I think the likes of Dr. Ellis have most definitely made this a lot worse. And it has only been in recent months that the Medical Board of California has actually taken Dr. Ellis and his methods seriously. After the accusations, not just in 2019, but especially since then, of Dr. Ellis' repeated negligent acts, our good doctor will, as of this year, go on probation for 5 years. He is being limited to performing a maximum of 10 surgeries per week. He has to voice record all conversations with his patients, and he is required to complete courses in ethics, record keeping, people skills, and clinician communication. Now, a lot of the first-hand information and testimonies that I have gotten, I have found on a forum called Fellow Boards, and this is an online community of men who discuss male enlargement surgeries and their journeys. Now, I'm not shouting this forum out because it's a good place or anything. I think, at least depending on what thread you're on, it is very masculine. There is a lot, and I mean a lot, of insecurity and clearly a lot of very deep-rooted trauma. There's a lot of comparing of genitals and commenting on one's failure and asking for information and advice from people, especially when it comes to the best and the worst surgeons. But a thread on Dr. Ellis' probation is very, very telling of what men are feeling, especially men who have undergone this P-Sheath procedure. And honestly, the stories and the testimonies are horrifying. One such negligent act reads, he, that is Dr. Ellis, uses his victims to try new ways to test his implant. He wanted to give me a new implant for free if he could insert it under my glans. Obviously, I cannot show a glans here, but you can just Google it and then just imagine what it means to have a sheath, a silicone sheath, placed under your glans. He didn't care about how it would hurt and kill happiness and function. He just wanted to try it. I could not believe he would want to do that. I also talked to an attorney in Beverly Hills, and he said my case would be so weak due to all the papers I signed, and he would not take it. I really think some of these attorneys just don't want to deal with D cases, period. And you know what? Personally, reading through this forum was actually just heartbreaking. I think I've said that word about 12 times in this video, but really a lot of this is incredibly, incredibly heartbreaking. This isn't just disgruntled consumers who aren't happy because their package isn't as big as they'd imagined it would be. These are your everyday men who you walk past every day in the street, who have been dismally failed, not just by urological entrepreneurs, but I really do think by society and our inability to actually honestly and vulnerably talk and communicate about such things. The sense of real deep-rooted trauma and psychological angst that many of these men exhibit, at least in reading this forum, is really quite catastrophic. I read one testimony and story of a man who had his P-Sheath procedure back in 2012, and 3 years ago, a piece of the sheath broke off, and it is just floating around in his candelabra. And after reading that testimony, I read several more of men who had the exact same issue. They just have pieces of the sheath floating around in their member, in their body. And what is most heartbreaking is that when these things happen, from chronic pain to bits and pieces of the sheath breaking off and floating under the skin, most men are too embarrassed to seek out medical help because of the shame. Reconstructive urologist Dr. Gordon Murr conducted one of the most comprehensive studies ever done back in 2016. He surveyed 15,000 men in order to discover how big their members should be and how big they thought it should be. Almost literally all of the men's members were in the range of what is considered medically to be normal. However, 80% of them wished that their members were bigger. Interestingly, the same survey found that a mere 15% of women were unhappy with the size of their partner's candelabra. Clearly, there is a lack of communication and a mismatch somewhere here. As Dr. Murr said, men are really not listening to what women actually want when it comes to P-enlargement surgery and the reasons for getting such surgeries. I think at the same time, tearing a man down because of his size is incredibly common, especially online. Small d energy, or SDE, is an insult hurled around like a baseball to describe insecure behavior that seemingly derives from size inadequacy and thus needing or wanting to compensate. And it feeds into a rather archaic belief that is very much still present. That is, that a man's size is somehow connected to his personality. If you're Andrew Tate, clearly you have SDE rather than just being, I don't know, Andrew Tate. The idea that the size and shape of a male member is a reflection of personality is a bit medieval. I don't care about Trump. That is Stormy Daniels comparing Trump's candelabra to the mushroom character in Mario Kart. But I, the author, would hate it if any teenage boy got the impression that they were being judged in that way. These days, women refuse to be shamed over having, say, a baggy labia. We have owned it. We've had a healthy conversation about it. That hasn't yet happened with the candelabra. Where are the comedians telling other men or boys that being average size is okay? Where are the role models going public about being 5 inches? Who will be the average sized pea pioneer who first speaks out on this taboo? Dr. Gordon Murr had the following to say and the following warning about Dr. Ellis' invention and silicone fillers. They're awful. Don't do it. As for fillers, getting silicone out of your member is a nightmare because it sticks to everything. What women actually want is men who are kind, funny, and not obese. If you're really that worried about giving your partner pleasure, buy her a rabbit. Live your life. For God's sake, leave your member alone. Blunt words, but I would definitely say true words. Sadly, a vicious cycle perpetuates itself in this lucrative industry, which I doubt the words of Dr. Murr will be able to counter anytime soon. The male enlargement community is shrouded in shame and stigma. To acknowledge that you want a bigger candelabra is a shame in and of itself. I mean, why would anybody want a bigger one if the one that they already have is big enough? As a result, urological entrepreneurs can sell the misconception that perfectly normal-sized men have an abnormality. They are therefore in need of enhancement that will resolve all their psychological and self-image issues. Also, the vast majority of men who come out with their testimonies and claims do so only anonymously. This makes accountability to the damage being done by these urologists nearly impossible. Dr. Ellis, like many of these urologists, make their patients sign lengthy consent forms that releases their ventures from any liability. And this is especially the case if a patient needs post-op treatment. And I swear the number of YouTube channels that I have been watching in the last few days of urologists who are promoting their services in this way is honestly astounding, especially based on how unregulated it is and how ready these urologists are to sue anybody who talks about them. This entire lucrative industry is subsumed in confidentiality agreements, in settlements and lawsuits. Dr. Ellis actually paid one of his patients $5,000 to remove a negative review that he wrote online. The shame in all of this is honestly so real. One post on Fellow Boards reads, "Should we, the men that received this implant, tell the whole disaster story in the complaint? Will our names be public knowledge?" In the opinion of many investigative journalists and reconstructive urologists, these urological entrepreneurs are salesmen before they are medical professionals. And they are going to keep selling the next big thing to men who are made to perpetually feel inadequate and are made to fixate on this perceived inadequacy. I think for many, this whole industry will rarely speak to the saying that men will literally do anything except go to therapy. And you know what? For very understandable reasons. Not many men, again, for very understandable reasons, are going to feel at all comfortable talking about this to what is most likely going to be a woman therapist. And all of this, again, feeds into this vicious cycle that so many urological entrepreneurs are profiting off of. Currently, the new alternative to the P-Sheath is the P-Long, invented in California by Dr. Judson Brandeis. The P-Long procedure firstly involves getting blood injected into your candelabra to activate tissue growth, followed by taking nitric oxide tablets called spunk. Sorry, I just have to interrupt to say how absolutely incredible I find this advertising campaign of spunk. It may help improve, it could help promote, it may support healthy cholesterol levels and heart function, it might help relieve prostate swelling and inflammation, it may improve the quality of your everyday life. A lot of mays, mights and coulds. This is modern marketing when you have to get around checks and balances and when you are selling, well, allegedly, because all of this is obviously alleged garbage. You then have to put your candelabra into a traction device that stretches it. After stretching your candelabra, all you have to do is then place it into another device, a vacuum device invented by a Dr. Jewel Kaplan that is going to give your candelabra girth. The P-Long procedure needs to be repeated every single year, and each procedure costs a minimum of $5,500. And this importantly does not include the cost of the tablets, that is the spunk tablets, nor the cost of the traction device and the vacuum device. Each, I'm sure, sold separately. And I do love one of the taglines of this vacuum device: boost rigidity for maximum penetration. Because women don't want to be loved in bed. All they want is for their cervix to be painfully plowed by an electrically pumped. I am so sorry, but that is all I can handle today. This isn't something that even affects me in any shape or form, either directly or indirectly. But honestly, if it is affecting me this much, I cannot imagine what people who are actually directly involved or implicated in this, who are in these forums, the men who are considering such procedures, the men who get such procedures are going through. I would be so incredibly grateful if any man watching this would share his perspective on this, especially if you are a man who has gotten either surgical or non-surgical intervention. If you are a part of the P-enlargement community, I would love to hear your thoughts and your perspective. This was honestly a deeper rabbit hole than I could have ever imagined jumping into, and I really do not think that I have done this topic nearly enough justice. But as I said, I'm afraid that that is all I have the stamina for today. Thank you so much for watching this video. Please do be respectful and considerate in the comments. There is a lot of trauma, a lot of sadness, and a lot of heartbreak around this topic. And I really do sympathize as much as I possibly can with anybody who is going through anything in relation to this. Just always remember to do your research, not just in forums and not based on the opinions of other people, but especially based on the opinions of reputed sources of actual, credible, medically accountable urologists and cosmetic surgeons. TikTok and social media are most definitely not the place where you're going to find them, regrettably. Thank you so much, as always, for giving me the time of day, and I will see all of you very, very soon in the next one.